In the name of merciful God, I want to present my research with title The Effectiveness of Conventional Cognitive Behavioral Therapy and its Computerized Version on Reduction in Pain Intensity, Depression, Anger, and Anxiety in Children with Cancer, a randomized controlled trial. It was actually the work of my doctoral thesis, so that I can explain more about this. Uh, what motivates me to do this was that one day, together with my brother's family, we went to the hospital for an eye examination, and my nephew, who was 1 year old that time, had come to hospital for cataract surgery. Unfortunately, the behavior of medical staff showed a disregard for the children's age and anxiety problem. And this disregard made my nephew develop a phobia of medical procedures. And it was there that I decided to help the children who are in hospital and especially suffering from pain. Maybe those who work in the treatment field are not very aware that diagnostic and treatment processes can be stressful for kids. This made me decide to apply my knowledge in field of psychology to help this group of kids, and so I started as I studying and found that the computer program game can be used for this aim, and I use a computer intervention make it possible to help a lot of people. It creates an opportunity for people to use this service who don't even have access to simple psychological service. So I came up with this idea and creating a computer program to help this group of kids. Because creating this computer program required a lot of expertise, such as directing, imagining, sounding, Photoshop animation, autoplay programming, and its high cost of cooperation from other fields at that time, I decided that I would learn those by myself. The next point is that when I started my work, using the internet and the computers was not very common for children. So I faced a bit of guards, and some didn't believe in its effectiveness. But thanks God, the results show that this work can help a lot of children with cancer. Now I wanted to explain to you more about what we did in this program and what happened. Since last decade, the epidemiology of pain in children is considered. Childhood pain is important because of the challenge in daily life and its effects on the future. For instance, children experiencing abdominal pain are at increased risks of somatic symptom, mental disorder, and hospital admission for unexplained medical reasons during adolescence. Children with cancer often experience pain due to disease progression or treatment side effect. The prevalence of pain in such children is estimated at 25 to 50% depending on the stage of disease and the cause of the pain. The memories of pain experiences in children may affect the way they react to later painful experiences and accept medical interventions. What is remembered about past painful events plays a pivotal role in predicting and responding to future problems. Painful procedures are accompanied by negative emotions. The prevalence of anger and depression is higher in individuals experiencing chronic pain compared with healthy people. Chronic pain is common in children. Significant portions of children receive inadequate assessment and management of pain in hospitals. It particularly occurs in the context of procedural pain. Experiencing pain of greater than moderate in intensity in childhood is associated with short and long-term adverse physiological and psychological effects. Uncontrolled pain in newborns can change the process of pain, and perception can affect physiological, social, and neurocognitive development outcome. Due to advancement of technology and the needs of healthcare, various therapeutic methods such as internet-based and computerized CBT are developed. Internet-based therapy is effective in several disorders such as anxiety and depression. Interventions applied to pain management are generally expensive. CBT is one of the most popular and effective pain management therapies utilized in many psychiatric disorders such as depression and anxiety. It is provided that CBT is an acceptable intervention for the ones experiencing pain. The basic principle of CBT for controlling pain include patient-based assistance to indicate how behavior and cognition can affect the perception of pain. During treatment, patients are encouraged to learn coping skills and restrict cognition and apply coping skill to wide range of daily activity. One of the negative aspects of treatment with CBT is often related to developing countries. High cost and inaccessibility make it an unavailable treatment. As the internet spreads across the globe, CBT can implement as internet-based intervention. The use of technology can eliminate almost all of the above-mentioned obstacles. Family can use computer-based program at home for the sake of confidentiality. They receive treatment without fear of being seen in mental health clinics. The experience of pain in cancer is widely recognized as a major threat to the quality of life. Relief of pain is a priority in oncology care. By the disease progression, pain management should be presented at a different level from the disease onset, even for those who are in the final stage of life. Cancer is one of the most painful chronic disorders in children because of the significant impact of childhood cancer on both the patients and their families. A computer program is designed to help children to cope more effectively with the circumstances. Because of some limitation in the availability of psychological services for such patients, CCBT may be suitable alternative to conventional CBT due to more accessibility. The study objectives were described to the parents, and written consent was provided by the parents for ensuring the presence of the participants. The subjects signed an agreement. The CBT group attends 6 45-minute psychological sessions. The CCBT group received a guidebook including parents section and homework, as well as compact disc containing the contents of all 6 CBT sessions. Psychoeducation and training were provided via text, animation, and games. After last session in the 6th week, the participants were re-evaluated. The therapeutic package was designed based on the article in this area and the content of Handbook of Pain Management. 3 clinical psychology experts confirmed the content validity of package. Table 1 shows the mean and standard deviation of the variables in pre and post tests. In addition, Mankova was used to examine differences among the 3 groups. The result of Table 2 showed no significant differences between the 2 intervention groups and the control group in terms of depression, anxiety, anger, and pain. In other words, the study variables were homogeneous in the 3 groups in the pretest. The result of Table 3 show a significant difference between the 2 intervention and control groups in the post-test in terms of depression, anxiety, anger, and pain. In other words, CBT and its computerized version could reduce depression, anxiety, anger, and pain in the post-test. As Table 4 shows, the 2 methods of intervention used in the present study did not differ significantly in terms of changes made into the dependent variable. However, it is shown that in CBT, the difference of anger score between pre and post test was greater than that of CCBT, which means the CBT was more effective in reduction of anger. Because of limitation in time, I summarize the result and conclusion. The finding of the study indicated that both intervention could reduce negative emotion associated with cancer, for example, pain, anger, anxiety, and depression in children compared with control group. In addition, there were no significant differences between 2 intervention groups. It means both interventions were useful to reduce pain and enhance adjustment. The CCBT can be authorized in case of no access to psychological and psychologist service. Thank you for your attention.